Well, kidneys might not get the credit they deserve, but they're very, and we mean very essential to keeping everything running smoothly inside our bodies from tip to toe. Let's say, without them, you just can't make it. You can't survive even a day without them. These small bean-shaped organs work around the clock to filter waste, maintain fluid balance, and even regulate things like blood pressure. To put it simply, kidneys are the unsung supermans of our delicate body. But when they aren't functioning properly as they should, it can cause some serious problems. One issue that often flies under the radar is proteinuria. It's a condition where protein leaks into the urine, which can signal kidney damage and lead to more complications over time. If you've heard of proteinuria or know someone struggling with this creepy stuff, you probably already know how concerning it can be. But here's something not a lot of people are aware of. There's a vitamin out there that has the potential to help reverse kidney damage and stop proteinuria in its tracks. Sounds magical? Well, it's just science. In today's video, we'll dive into what proteinuria is, why it matters, and how this simple vitamin can make a real difference. If you're looking for a solution, or just want to learn more about kidney health, stick around. By the end of this video, you'll have a much clearer picture of what's going on and how to take action. So, let's get into it. What is proteinuria, and why is it bad? Before we talk about how to fix proteinuria, let's break down exactly what it is and why it's such a big deal for your health. Proteinuria, also known as albuminuria, happens when an abnormal amount of protein leaks into your urine. Normally, your kidneys filter out waste and extra fluids from the blood, while keeping essential nutrients, like proteins, in the bloodstream. These proteins play a key role in building and repairing tissues, producing hormones, and keeping your immune system strong. So, you can imagine that when your kidneys aren't functioning properly, they can allow too much protein to slip through. And that's where the trouble starts. A healthy kidney works like a fine-tuned filtration system, keeping the things we need and flushing out the waste. But when kidney function is compromised, whether due to injury, disease, or something as simple as high blood pressure, this filtration process can break down. Instead of keeping those vital proteins in your body, the kidneys allow them to pass into your urine, leading to high levels of protein in the urine. This is what doctors call proteinuria. Now, if you're wondering why that's such a big deal, here's the thing. Protein is a vital nutrient. If your kidneys are leaking protein, it can result in nutritional deficiencies, weakness, and a compromised immune system. In the long run, this can affect your body's ability to heal itself and leave you more vulnerable to infections and illness. But it gets worse. Proteinuria isn't just a sign that your body is losing a vital nutrient. It's also a red flag for kidney damage. Often, it's one of the first signs of chronic kidney disease or other kidney problems. Left unchecked, proteinuria can progress, leading to more severe kidney damage and ultimately kidney failure. The numbers are staggering, with millions of people worldwide affected by kidney disease. In fact, in 2025, kidney disease will become one of the leading health concerns globally, with rates of chronic kidney disease on the rise due to factors like diabetes, high blood pressure, and obesity. The CDC recently reported that over 37 million Americans suffer from chronic kidney disease, and many don't even realize they have it. That's why understanding conditions like proteinuria is so crucial to live a little longer. So, why should you be paying attention to this? Well, aside from the direct impact on your kidney function, proteinuria can also lead to other symptoms like foamy or frothy urine, swelling in the hands, feet, and around the eyes, and even unexplained fatigue. And trust me, fatigue is not something you want hanging around in your life. But there's hope. Even though proteinuria can sound scary, there's actually something simple and surprisingly effective you can do about it. Now here's the twist. There's a vitamin that can help repair kidney damage, improve kidney function, and even stop proteinuria in its tracks. This vitamin works at a cellular level to boost the kidney's filtration process, helping to keep proteins where they belong, inside your body, not in your urine. It's a powerful solution, and it's found in plenty of foods we eat every day. We'll dive into which vitamin this is shortly. But the point is that you don't have to accept proteinuria as an inevitable outcome. So stick around, because this vitamin is about to change the way you think about kidney health and how you can protect those essential organs. But first, what factors cause proteinuria? Proteinuria can be triggered by a variety of factors, and its causes can differ from person to person. Let's take a closer look at the main contributors. One of the biggest culprits is diabetes, particularly if it's not well managed. When blood sugar levels remain high over time, they can damage the delicate blood vessels in the kidneys, making it harder for them to filter waste and proteins the way they should. As a result, proteins leak into the urine, and that's a serious warning sign. High blood pressure is another common cause of proteinuria. When your blood pressure is consistently high, it puts extra strain on the blood vessels, including those in your kidneys. This damage makes it harder for the kidneys to do their job, leading to protein leakage. Other medical conditions can also contribute to proteinuria. Glomerulonephritis, for example, is an inflammation of the tiny filters in the kidney, which can cause proteins to escape into the urine. Then there's lupus, an autoimmune disease where your body's immune system attacks its own tissues, including the kidneys. Another condition, amyloidosis, occurs when abnormal proteins build up in organs, including the kidneys, which can impair their function and cause proteinuria. Certain medications can also play a role. Non-steroidal anti-inflammatory drugs, commonly used for pain and inflammation, are one such example. While they're fine for short-term, prolonged or frequent use can damage the kidneys, leading to protein leakage. This just highlights why it's so crucial to monitor kidney function, especially if you have a chronic condition like diabetes or high blood pressure. If you fall into this category, staying on top of your kidney health is key to preventing proteinuria. One of the tricky things about proteinuria is that it often doesn't show any signs early on, which is why it's sometimes referred to as the silent killer. It can go unnoticed for years, quietly causing damage. However, when symptoms do show up, they can be pretty telling. Foamy or frothy urine is one sign, caused by the excess protein in the urine. Another common symptom is swelling or edema, which can appear in the hands, feet, abdomen, or face. This swelling occurs when the kidneys aren't able to regulate fluid properly, leading to fluid retention. The real danger of ignoring proteinuria is that it can snowball into much more serious kidney issues. Over time, untreated proteinuria can progress into chronic kidney disease, which can eventually lead to ESRD. This is when the kidneys lose almost all their function, and treatments like dialysis or even a kidney transplant may be required to keep you alive. That's why it's so important to understand just how vital our kidneys are to overall health. They don't just filter waste. They're responsible for balancing electrolytes, regulating blood pressure, producing hormones like erythropoietin, and maintaining the acid-base balance in the body. They also convert a form of vitamin D into its active form, which helps the body absorb calcium for healthy bones. In short, Our kidneys are crucial, not just for removing waste, but for nearly every aspect of our well-being. The mighty vitamin that can stop proteinuria. Now that we've got a solid understanding of what proteinuria is and why it's so important to take care of our kidneys, let's talk about something truly powerful that can stop this condition from progressing. The star of the show here? Vitamin D. Yes, you heard it right. Vitamin D, often called the sunshine vitamin, is not just for keeping your bones strong. It's one of the most crucial nutrients when it comes to maintaining kidney health and overall well-being. You might be surprised to know that vitamin D is a fat-soluble vitamin that our bodies naturally produce when exposed to sunlight. It's also found in foods like fatty fish, think salmon or tuna, egg yolks, and fortified dairy products. However, in today's world, many people have a vitamin D deficiency. Why? Well, we spend more time indoors. We use sunscreen, which blocks the UV rays that help our bodies produce vitamin D. And let's be honest, our diets aren't always the best source of this essential vitamin. It's also common for people with certain health conditions and older adults to have a reduced ability to produce natural vitamin D, making supplementation even more important. But let's get to the big question. How does vitamin D help stop proteinuria? Vitamin D's role in kidney health. Vitamin D does more than just help your bones absorb calcium. When it comes to kidney health, this vitamin works on a cellular level to fix kidney damage and improve the filtration process. Essentially, it helps the kidneys function better. It acts like the conductor of an orchestra, coordinating the various cells in the nephrons, the tiny filters in the kidneys, to work together and prevent protein from leaking into the urine. This is important because when kidneys are functioning at their best, they'll retain the essential proteins the body needs, rather than letting them pass through the filtration system into the urine. But there's more. Vitamin D also strengthens the glomeruli, the small clusters of blood vessels that play a crucial role in filtering out waste and extra fluids. By improving the integrity and function of the glomeruli, vitamin D helps reduce the risk of proteinuria and keeps those kidney filters working the way they're supposed to. The benefits of vitamin D don't end with kidney health. This vitamin is a master regulator of your immune system. It helps your body defend itself against infections by enhancing the immune system's ability to fight off pathogens, including those that cause respiratory tract infections. If your immune system is stronger, your kidneys benefit too, because a well-balanced immune system reduces the risk of kidney infections, which can worsen kidney function over time. But wait, there's more. Vitamin D is essential for building and maintaining strong bones by helping your gut absorb calcium, a key mineral in bone health. Without enough vitamin D, calcium can't be absorbed properly, leading to weak bones and potentially conditions like osteoporosis. Keeping your bones strong is crucial, especially as you age, because your bones are part of your body's support system. Much like the kidneys, they help keep everything in check. Vitamin D also plays a vital role in cardiovascular health. It helps regulate blood pressure and can prevent the arterial stiffness that is often linked to heart disease. Having the right amount of vitamin D in your system can significantly reduce the risks of hypertension, heart attacks, and strokes. So, in a way, it's like a superhero for your heart, kidneys, and bones. On top of all that, vitamin D has been shown to have a positive impact on mental well-being. Low levels of vitamin D have been linked to depression and mood disorders, which is pretty concerning considering how many people suffer from mental health issues. Vitamin D can influence the production of serotonin, the neurotransmitter responsible for regulating mood. So, if you're feeling a little off, it might not just be the winter blues, it could be your vitamin D levels. How to get more vitamin D? So, how can you make sure you're getting enough vitamin D to protect your kidneys and keep all these other benefits in check? First, it's a good idea to soak up some sunshine. Your skin makes vitamin D when exposed to sunlight, so try to spend some time outdoors each day, about 15 minutes for most people. But if you're someone who spends a lot of time indoors or lives in a place with limited sunlight, like during the winter months, eating foods rich in vitamin D can help. As mentioned, fatty fish, egg yolks, and fortified foods like milk, orange juice, and cereal can be great sources. If you're still not getting enough from the food you eat or sunlight, vitamin D supplements can fill the gap. But before jumping into supplements, it's always a good idea to check with your healthcare provider. They can assess your current vitamin D levels and recommend the right dosage or food sources based on your individual needs. It's important to be mindful of getting the right amount. Too little can lead to deficiencies, while too much can have negative effects, including kidney damage. We really hope this video has given you some valuable insights into the importance of kidney health and the role vitamin D plays in preventing proteinuria. Remember, taking care of your kidneys now can prevent bigger issues down the road. Prevention is better than cure, and there is no cure than prevention. If you found this video useful, don't forget to hit like and subscribe for more tips on how to stay healthy and protect your body. Until next time, get some sunshine, drink water, and give your kidneys the love they deserve. Life is short. It's not something we can take for granted. So let's make sure to take care of ourselves and live our best lives. As one wise old man said, "You can make trillions, but if you lose your health, then it's all for nothing." So always pick the best for yourself and your loved ones.